On today's Desert Living, we're going to talk about schizophrenia. It's a complex and chronic brain disorder that has no cure and affects about 2.8 million adults. It's a challenging journey not only for the patient, but also their loved ones. Board-certified psychiatric nurse practitioner Desiree Matthews is with us to discuss the realities of living with this condition. Welcome, Desiree. Let's get right to it. What is schizophrenia and why is it so difficult to treat?
So schizophrenia is a chronic brain disorder, and it can change the way that people behave, the way that they think, the way that they feel. And one of the biggest challenges when it comes to treating schizophrenia is the need for consistent and daily treatment. Oftentimes we use oral medication, and these need to be taken every single day, even sometimes multiple times a day. And it can be very challenging for anybody on chronic treatment to remember to take a pill every single day.
Now, how can we reduce the stigma surrounding schizophrenia?
So stigma, unfortunately, affects those individuals living with schizophrenia or a mental health diagnosis, as well as family. And it can really reduce the ability or willingness for somebody to seek help because of that stigma. So I'm happy to partner with Johnson & Johnson today to talk about schizophrenia. This is really the first step in clearing up myths that may surround the illness. There is hope that there is effective treatments for adults with schizophrenia, and that people can really thrive even after a diagnosis.
What kind of options are available for treatment?
So there's a wide array of treatment options available for schizophrenia, including oral medications, but we also have modern treatments for schizophrenia that include long-acting injectables, otherwise known as LAIs. And J&J does have 3 different options for adults living with schizophrenia. There's Invega Sustenna, which is given every 1 month, Invega Trinza, which is given every 3 months, and Invega Hafira, which is given every 6 months. Now, it's important to talk to your healthcare professional about all the risks and benefits associated with treatment. But for example, we can get an individual down to, just taking 2 treatments a year rather than taking treatment with an oral medication 365 days out of the year. So in many cases, it can be much easier for an individual to manage their condition this way with an LAI.
Now, what about the family members? What kind of advice can you give them?
So one advice that I have is really get into an advocacy group, understand the signs and symptoms, and really educate yourself about all the available treatment options. In my clinical practice, family members are oftentimes the ones coming with their loved ones and advocating and being sure that the individual with schizophrenia is really getting their needs met. I've had many families actually tell me that they wished a healthcare provider talked to them about an LAI and about these treatment options that could potentially be a better fit for that individual and make it easier for them to manage their symptoms.
And where can we go to learn more?
So if anybody is interested in learning more about the signs and symptoms of schizophrenia, what it is, as well as those long-acting injectables that I mentioned, you can visit a website called treatyourschizophrenia.com. That's treatyourschizophrenia.com.
Thank you, Desiree. Thank you for the great information, and thank you for joining us today.
Thank you so much for having me.
And we'll be right back.